My name is Josie Martin, and this is my presentation on the United States Healthcare Delivery System for NURN302. Introduction. The United States healthcare system is one of the most complex systems in the world. The primary players in the healthcare delivery system are providers like doctors and therapists, settings, as in inpatient facilities, outpatient agencies, and purchasers, insurance companies, government, or individual patients. The word system is a term used loosely as the components of the U.S. healthcare delivery do not work together in a cohesive manner, but rather in a complex semi-coordination of financing, insurance, delivery, and payment mechanisms. According to iSpor.org, the system is considered a mixed system, which involves a combination of both publicly government and privately financed coverage for health care. Understanding the complexities of our healthcare delivery system is important for healthcare providers and members of the care team in providing quality health care. Knowing the limitations on our providers and agencies, restrictions and regulations from payers, and cost realities and disparities for certain populations are all imperative to providing the most efficient and quality care possible. In other words, understanding the complexities of the system allows for more efficient and appropriate expenditure of resources for patients and adequate reimbursement for services as a provider. Providers. According to our text, Delivering Healthcare in America, healthcare is the largest and most diverse industry employer in the United States. While there are many different positions we can examine, for the purpose of this presentation, we will narrow it down to a select few, including physicians, dentists, pharmacists, and nurses. However, other providers can include positions like optometrists, psychologists, podiatrists, chiropractors, nurse practitioners, physician's assistants, midwives, and allied health professionals like different types of therapists and technicians. Physicians. Physicians are licensed doctors of medicine or doctors of osteopathic medicine whose role is to evaluate patients and health conditions, diagnose abnormalities, and prescribe medical treatment. An article by Phillips and colleagues notes that there are both general practitioners who provide primary care services treating common medical conditions without a specialty, and specialists who provide a care in a specialty area such as cardiology or pulmonology. Physicians, specifically the significantly high number of specialists in our system, has contributed to the increase in cost of healthcare by overutilization of expensive and invasive procedures and treatments. There is a substantial inequity across the United States in the physicians available for care based on CDC data. Dentists. Dentists are licensed doctor of dental surgery or doctor of dental medicine, and they specialize in diagnosing and treating dental problems related to the teeth, gums, and other tissues of the mouth. In an article titled Health Equity Needs Teeth, the author makes the point that while the private sector is increasing coverage for dental care, the access to dental care in the poor and underserved communities is not improving due to the separation of dental and oral health from general medical care. Pharmacists. Pharmacists dispense medications prescribed by physicians and dentists and provide consultation on proper selection and use of medications. They are licensed after graduation from an accredited pharmacy program that awards a Bachelor of Pharmacy or Doctor of Pharmacy degree, as well as a completion of state board examination. There are specialized fields of pharmacy including pharmacotherapist, nutrition support therapist, or radiopharmacist. In an article by Hurley Kim and Associates, the authors note that pharmacists play a crucial role in health equity and addressing disparities by providing education to patients that pertains to a variety of socioeconomic, racial, and cultural factors. They are also responsible for working closely with physicians to achieve a therapeutic outcome with prescribed medications, not just filling and handing out prescriptions. Nurses. Nurses make up the largest group of healthcare professionals. Nurses are responsible for hands-on care for sick and injured patients and focus on well-rounded, patient-centered care that includes physical, mental, emotional, and spiritual needs of the patient. Nurses make up one of the largest occupations in the U.S. with nearly 3 million RNs, but there is expected to be a significant nursing shortage by 2030. Nurses' roles vary greatly depending on the setting they work in, but the primary responsibility in general terms is implementing the prescribed treatment set by the physicians. This can range from things like administering medications, completing wound care, and providing education. In an article titled The Role of the Nurses in Eliminating Health Disparities and Achieving Health Equity, the authors note that nurses working in all settings can help to advocate for health equity for their patients by providing culturally competent care and working to address gaps and problem solving to improve patient access in the outpatient setting with appropriate and personalized patient education. Efforts by the Affordable Care Act put $30 million towards supporting advanced nurse training for nurse practitioners and certified nurse midwives to address the nationwide primary care shortage. Healthcare settings. The healthcare setting is the location or type of facility that a patient is visiting and receiving care. The primary types of settings include inpatient care and outpatient or ambulatory care. Under these general distinctions, there are a much larger variety of the specific type of setting. For the purpose of this presentation, we will be looking specifically at a few different types of inpatient facilities, like a general short-stay inpatient hospital, psychiatric hospitals, and children's hospitals. We will also review some outpatient settings, including primary care offices, private or group practices, home health agencies, and community health centers. The scope of both inpatient and outpatient facilities reaches much farther than these specific settings explained. Inpatient facilities. She and Singh explains inpatient care is when a patient stays overnight in a hospital or healthcare facility for 24-hour care. The scope of inpatient facilities is quite large and can be characterized using a variety of criteria, including services provided, ownership, public access, location, size, or length of stay. General short-stay community hospitals. General short-stay community hospitals are a common type of facility that provide a variety of services, including general and specialized medicine, surgery, and obstetrics to meet almost all needs of the community it serves. Hospitals work to combat inequities by providing culturally competent care across socioeconomic classes. It's noted in an article, How Do Hospitals Address Health Inequities Experienced by Children and Young People?, that many hospitals like this provide financial services, even Medicare and Medicaid specialists that can help patients enroll for coverage. These general hospitals also work to provide culturally sensitive care by offering patient-centered services like clergy visits, prayer chapels, and tailored care to comply with cultural or religious practices. The primary issue in health equity from a hospital is in discharge planning and success for patients after the hospital. Adequate care can be provided to almost anyone while inpatient. However, the hospital contributes greatly to the health outcomes of the patient following their discharge based on how well they address all needs of the patient to ensure success in caring for themselves before going home. Psychiatric hospitals. Psychiatric hospitals are inpatient facilities that provide diagnostic and treatment services for a variety of severe mental conditions, including bipolar, schizophrenia, depression, and serious emotional disturbances. These hospitals meet basic medical needs while also providing psychiatric, psychological, and social work care to patients who have the potential to be a danger to themselves or others, are at risk for severe outcomes while in the community, and require more close supervision in an inpatient setting with 24-hour care until their conditions are managed with medications or counseling services and they are safe to return to the community. These hospitals greatly contribute to combating inequity by treating an underserved population in the mentally ill. Children's hospitals. Our text explains that children's hospitals are community hospitals that typically specialize in complex, severe, or chronic illnesses in children. Children are considered a vulnerable and underserved population, especially children in poverty or minority groups. In an article by Brennan and Associates, the authors note that children's hospitals bridge this gap, providing equitable care to this vulnerable population. Healthcare for children can be one of the most sensitive and difficult fields, as most healthcare research has been conducted on adults, and despite popular beliefs, children are not just little adults. They require their own fields and specialized treatments, making care in this field very important and specialized. Outpatient services. In contrast to inpatient care, outpatient services are for patients who do not require 24-hour care or an overnight stay in a facility. These services can include outpatient procedures like day surgery, but the majority of these settings involve the long-term management of conditions or injuries. Primary care. Primary care involves our general practitioners. This care is provided in private or group practices where office-based physicians who provide basic patient care with minimal examination and treatment of a wide variety of basic health conditions. She and Singh explains this type of care as the point of entry to the healthcare system, addressing the patient and community health as a whole. The role of primary care providers is to evaluate patients and health conditions, diagnose abnormalities, and prescribe treatment specific to the patient. Primary care also focuses on health promotion and illness prevention. There is a current primary care shortage in combination with a surplus of specialists, which leads to an inequity in care provided. To generalize points made by Shi and Singh, the shortage of primary care and surplus of specialists leads to an overutilization of medical treatments and technologies, specifically to more financially secure populations who can afford it or have more coverage with their insurance. This leaves poorer or more vulnerable populations even more underserved, struggling to get even the most basic care from a primary care provider due to the high demand. There is a significant inequity in primary care providers in contrast to specialists, making access to these providers very difficult with long wait times to see physicians. Home health agencies. Home health agencies are agencies that send nurses, therapists, and personal care aides to the homes of patients following the discharge from an inpatient facility or following a visit with a primary care provider. Our text explains that these agencies work to combat inequity in underserved and rural populations who have difficulty traveling to appointments and affording certain care. These patients and this population generally improve in their ability to care for themselves following home health care services. In turn, by being able to better care for themselves and learning to manage chronic conditions in the home, decreases health care expenditures on the whole system. Community health centers. Our text explains community health centers as the primary care safety net for the poor and uninsured in both inner city and rural areas. These centers provide family-oriented primary and preventive care and include a wide variety of programs, including case management, transportation, translation, drug and alcohol programs, mental health services, health education, and social services. These facilities play a large role in addressing and reducing health disparities by providing health care to underserved populations. In many of these types of facilities, care is provided to anyone and nobody is turned away despite financial ability to pay. Purchasers. Financing in our medical system is the most complex component. We have insurance that is the private sector, the government sector paid for by taxpayers, and the individual, which is the portion the patient is responsible for. Our system is made up of a combination of these three factors in a variety of different ways. Insurance. Shi and Singh explains insurance as a mechanism for protection against risk of serious health issues that could pose a significant financial loss to an individual. There is private and public or government-based insurance. Private insurance is a system where individuals pay a premium or monthly fee for coverage for medical care. Individuals are also responsible for meeting a deductible before benefits from the insurance plan can be accessed. Another fee, called a copayment, includes a flat rate for each time services are accessed, like at a doctor's office or when paying for medications. Private insurance can be very expensive, costing patients hundreds of dollars per month, plus a deductible of anywhere from $1,000 to $5,000 before services can be utilized. This high price point contributes to the healthcare inequity, as it's difficult for lower economic groups to attain insurance or even use their insurance if they have it. Most private insurance is employment-based, also leaving the unemployed with limited options for coverage. The Affordable Care Act worked to ensure more lower-income individuals with the development of the healthcare marketplace, but there is still a large gap between people who qualify for Medicaid and who can afford a private insurance plan. The government. The government funds healthcare coverage to individuals who would otherwise not be able to afford it. This care falls into two categories, including Medicare and Medicaid. Medicare finances medical care for people over 65, disabled people, and people who have end-stage renal disease. Part A and Part B provide general insurance, while Part C involves Advantage plans, and Part D includes medication coverage. While the government funds these programs, there are many limitations and regulations on what is covered and services provided. Medicaid finances medical care for people based on financial status, insuring low-income individuals, pregnant women, and children. Medicaid works diligently to provide care to underserved and needy populations, directly combating health inequity. Individual. Individual purchase private insurance. Self-employed people use this to get coverage for health care, especially in the event of severe injury or illness. This was previously unavailable to high-risk individuals, but those limitations were eliminated by the Affordable Care Act. Individuals with health insurance still pay out of pocket for things like premiums, deductibles, and out-of-pocket costs, or for things not covered in their specific plans like medications or specialized services. Again, this high price point for these insurance costs for individuals further contributes to healthcare inequality as lower income patients fall between the cracks of qualifying for Medicaid but still not being able to afford insurance or not being able to afford the things that are outside of what their insurance covers. Conclusion. Our system is complex and always has room for improvement. Understanding the different parts of our system can help us to provide more well-rounded, educated, and patient-centered care to best serve the needs of our patients. Thank you for listening.